because information is power, and because now patients, individuals will be generating their own data, not at the mercy of a doctor or a visit to a clinic, but rather, any time when at their convenience, or even passively without even pressing start. So that changes everything. That tilts the whole, what has been asymmetrical information towards the patient, towards the individual. And this is a power play that's going to be more and more emphasized over time, and so that each individual should own their data. That isn't the case today. Their doctors and hospitals own people's data in the United States in 49 out of the 50 states. And that has to change. But it's going to be forced because people will not be relying on the sacrosanct electronic records that are housed in doctors' offices and hospitals, but rather generate their own data. And certainly it should be a civil right that you have rights to your medical data.
Okay, well, let's break it down. When we look at our smartphone, we think of this marvelous device. We talk to it. It has our schedules and things like that. But what you're saying is your smartphone, in some sense, can also calculate your blood glucose, your blood pressure, and even sense your breath and saliva. So let's break it down. What kinds of attachments can you put on your cell phone such that it becomes, in some sense, a doctor's laboratory?
Right. Well, it'd be the patient laboratory as well. That's the difference, because everything's so eminently portable. So my favorite these days is that I can change a smartphone into a total body ultrasound, high-resolution device with imaging as good as the one that's in the hospital that costs hundreds of thousands of dollars. I even put on Twitter my head-to-toe ultrasound.
Is that right?
Sparked a lot of interest, actually. But, the fact is, as a cardiologist, that I can image my heart, my patient's heart, through my smartphone, exquisite images, and even do color flow mapping of the blood in real time. So that's just one example of imaging on a smartphone. But you've alluded to, Michio, the fact that all these metrics of man, like blood pressure and glucose and oxygen concentration in the blood, and a long, long list, can be all captured through a smartphone, whether it be with a watch or a Band-Aid or, some other ad to the phone. And so basically using the power of this remarkable microprocessor in the phone to get wireless connectivity with your body.